Hello, my name is Noah Wilson, and my project is the non-invasive breath analysis for testing blood glucose in diabetics, and I was advised by Dr. Jacek Borsau in the physics department. In diabetics, acetone is more prevalent because their body breaks down fat first, and acetone is produced by the breakdown of fat. This leads to higher concentrations in their breath, and we're focusing on the breath measurements to allow for a non-invasive measurement. We do this measurement by using Raman spectroscopy, and this harnesses the Raman effect, where each molecule has a distinct shift that you can see in light. And so we send a laser light at it, and for acetone, it shifts that light the same amount every time. And so we're able to easily identify different molecules using this setup. In our setup, we use a 532 nanometer laser, and we bounce it off some mirrors for alignment and then send it through the multipass. This multipass is very important because it allows for multiple passes through the breath container, which contains the sample that we're trying to measure. And this allows for a greater chance for us to see the Raman effect. It's a very weak effect, and so with this multipass, we're able to see it much more easily. Lens 2 here is what collects the light, and then it goes through this prism, and that flips the image so that we're able to see more of the signal in the spectrograph, and then the light goes through lens 3, which then images it onto the spectrograph where we can get our reading. So far, we have done about 30 trials, and we've identified acetone in one of those 30 trials. This could be due to multiple things. One is some insufficient sensitivity. We could also improve the optical and multipass alignment, and the subject might be producing acetone concentrations that are just below the detection limit of the system right now. In this one breath spectrum, we were able to see here on the right acetone, and on the left is the nitrogen peak. We are measuring it relative to the nitrogen peak because the body does not use nitrogen, and so the concentration of nitrogen should stay relatively stable throughout the whole testing process since the body does not use it, so we can reliably test acetone against nitrogen. You can see that the acetone signal is quite small compared to nitrogen, and I have it blown up here in the green circle. For an outlook for this project continuing, we are looking at testing at different times of the day. This might be a reason that we don't see acetone, is that acetone production might be dependent on the time of day. We're also looking at realigning the optical and multipass setup to get a better sensitivity. And in the future, if we are able to find a correlation between acetone concentration and blood glucose, this could be used as an alternative to the finger prick to measure a diabetic's blood glucose. Once again, I would like to thank SURF for their support, as well as Dr. Borisau and the physics department for their support. Thank you.